Hello, and welcome to part two of the Paid Family and Medical Leave Program. In part one, Lisa Netzer has explained all of the things that practice owners need to know to do and prepare for this Paid Family and Medical Leave Program that's going to embark in 2026. In the second half, we're going to talk about how to thrive and survive with short-term staffing coverage. And for those of you who don't know my background, I am Shannon Snell. I own dental consulting company as well as Dental Recruiters. Dental Consulting Company is a practice management consulting agency focused on clinical profitability, front office systems, and of course, insurance landscapes, which means we take practices out of insurance networks to trim that out. And we could take practices fully fee for service. We also work in the transitional space when doctors are purchasing practices. So we help them with the credentialing aspect of that whole transition process. And then on the other hand, we help them get out of insurance once they get established in their practice or potentially trim that out. Dental Recruiters is another company that I own. And that used to be a very large staffing company called Crown Staffing. So we have since rebranded to focus more on the recruiting aspect and the consulting side of that to help practices design really great ads, how to interview correctly, and how to really position yourself to attract top talent. In addition to that, I am currently an actively practicing dental hygienist. When I first started, I graduated from the U of M, and the only thing I did was provide temporary services to over 45 different practices. So I had the opportunity to see patients in a temporary environment as a dental hygienist in over 45 different office settings. The last part of this was my experience as a practice manager. I was a practice manager for almost 6 years, 6 to 7 years, in a very large practice with over 20 employees, very high production office. And so I not only have the experience of working as a temporary dental hygienist, being a practice manager, navigating the waters on all of the different things that you need to have in place to work with different staffing agencies. And I've also owned one. So very excited to share some tips and tricks on how to be very successful when you have short-term coverage at your practice. The first thing that we're going to talk about and what I want everybody to understand is this concept that is the Pareto principle, if you haven't heard of it yet. And what the Pareto principle is, and we talked to a lot of our clients about it, and it applies to every part of their practice and almost every part of their life, is that 20% of the tasks that you do each day yield 80% of the results. So only 20% of what you do on a daily basis actually matters to produce that 80%. The rest does matter, but it's almost noise. That 80% in this blue circle that we're looking at, that is all of the noise of our day. And what I really want you to think about is when you are considering replacing one of these individuals for this paid short-term leave that's going to become on us in 2026, what do you actually need? And this is going to kind of help you. So you can look at potentially a dental hygienist. What do they do over the course of the day? They open their rooms, they might do some sterilization. They're going to seat their patient, they're going to prep their charts, they're going to see their patient, and they're going to do some other things throughout the day as a dental hygienist naturally would. And when you look at that list, if it's 10 things long, for example, and you ask a dental hygienist, what do you actually need a dental hygiene license for? They're going to mark C patients and potentially prep their charts, right? That's 2 out of the 10 when the rest can be delegated. Now, that's a kind of euphoric example, but that's kind of what I'm getting at. If you look at a dentist, for example, their 20% is seeing their patients, right? And practicing to the top of their scope of practice and to the top of their license and really delegating everything else. So the noise, that 80% of a typical dentist, when you're potentially looking at locum tenens coverage, if your associate's going to be out and you need them replaced, is the 80% is not taking your own impressions, making your own provisional crowns if you're doing traditional crowns and not same day, It is not writing your own notes. And quite frankly, as a practice owner, it's not paying your own bills. So the more you focus on that 20%, what, in other words, what we call your unique ability, your zone of genius, or sometimes we just phrase it as your 20%, and our clients and our team, they all know what that means. You're really, really going to drive the results. And so these are 8 different specialty groups within a dental practice. You have dentists, dental therapist, hygienist, assistant, front office, practice manager, and what has been increasing in popularity is a float, which is an unlicensed individual. The float has become popular, I would say, ever since 2020. And the float is that key individual that's going to allow all of these other groups to stay within their 20%, right? The float is going to take care of the noise of our practice. And of course, I have a cleaning crew in there a little bit as a joke, but a little bit on purpose too, in that sometimes we worry too much about who's cleaning what and who's emptying the garbage, but we're not really focused on what the actual patient care is. And we get all wrapped up in what that looks like. And when you're looking at replacing somebody, asking yourself, what can you delegate and what do you actually need coverage for? So the first thing that we're going to look at, and again, when we were doing this webinar live, I always said, please don't shoot the messenger. And I'm very happy that it's virtual. But this is what we're finding in terms of compensation for short-term coverage. So with our recruiting company, we're very aware of what is going on in the market right now. And this is what our clients, specifically in the metro area, outstate practices could look a little bit different. What they're looking at in terms of standard wages that we're seeing with each particular position. So you'll find that the DDS locum tenens, that's another way to say temporary dental coverage as a dentist, they're going to be charging anywhere from $130 to $150 an hour if they aren't on a comp model. A comp model would be something like what an associate is being paid on right now, in that you could pay somebody $130 an hour, and should their production surpass that break-even point, you could give them a percentage of that. There's also lab fees involved, and there's different, more convoluted things within their compensation. But what you can expect to pay should you need to replace your dentist with locum tenens coverage is $130 to $150 an hour. Dental hygienists right out of school, they're asking around $52 an hour without any experience. This can range up to 60. I don't know if we've seen it surpass 60 all that often within the metro area. And that could be a hygienist that has been practicing for a very long time. A lot of offices are switching over to comp models for a dental hygienist. And our team is very, very good at implementing that, projecting the numbers on what they could potentially earn at the practice. And a lot of times we find that there's practices in a deficit because their hygienists aren't meeting that a third formula that we coach on. And most of the time it's not due because the reason isn't because they're overpaid. The reason is because they're underproducing. And so when we look at that, there's obviously chances for them to what we call grab the low-hanging fruit in the practice and really surpass that break-even point and be on what we call a comp model. Any questions about that, feel free to send me an email, because right now I'm not going to get into exactly what that is. But when you look at dental hygiene wages, dental assistant, front office team, and a float, all of those ranges we have there, you can expect to increase that wage by 60 to 65% for short-term coverage. So while a dental hygienist on a standard scale is 52 to 60, if it's short-term coverage, whether you're doing it internally, whether you're hiring through a staffing agency, you can expect to pay between $80 to $90 an hour for a dental hygienist, for example. So increasing that wage 60 to 65% is going to be what you're looking at. Now, I am going to unpack each particular position, very 30,000-foot overview, but also give you some key things to think about when you're trying to set up for success for coverage in each position. So with a dental hygienist, the first thing I want you to do is look all the way down to this slide and ask yourself, how many dental hygiene hours do we actually need as a practice? When we do when we do practice analysis presentations, we do this formula all the time for practices, because sometimes practices make hires or get coverage based on what they feel like. Like I'll have a practice manager say, Shannon, gosh, we're booking out X number of months. I feel like we need to hire another dental hygienist. Well, let's not make any decisions with our practices based off of feelings. Let's look at the actual numbers. So we have a formula we use, and if you want to know the details of it, again, feel free to email me. But essentially, we take your active patients, we divide it by 24 because that's half of 48 weeks, assuming you take 4 weeks off a year. And that's going to give you the number of dental hygiene hours needed per week. You can further divide that by 8-hour days to see how many actual days you need. But I would encourage you to do this with your practice and see where you're at, if you're understaffed, overstaffed, and where you're at with that. An active patient, don't just pull whatever's in your practice management software. It's a unique patient visit within the last 18 months. So in the metro, that's what we deem an active patient. In our outstate rural practices, we do 24 months just due to demographics, potential farming communities where the patients might not, they're still very active in the practice, but we take that metric for our outstate practices. So if you are tuning in from that, you will do the 24 months for the active patient count. When you do this formula, you're going to get your hygiene hours needed per week, and then you're going to look at what do I actually have. The second layer of this is if you do not have a sound periodontal protocol in place, you're going to need more than what that actual formula states, because when you take a patient that is historically coming into your practice twice a year and you multiply that, now they're coming in 4 times a year, you're actually going to need more coverage than you actually have right now. So your periodontal percentage potentially plays a role in that as well. Now, if we zoom back to what we're focused on initially is I just need to figure out if I need coverage or not. My perio program is going to be where it's at. And that's totally fine too. So when you zoom back to that, do that formula, ask yourself, is there a need? If there is a need, we're going to look at how do we prepare for a productive day, opportunity costs of not securing coverage, and all of those things so that you can make sure when you do have a temporary provider in, they're as successful as you are allowing them to be. Now, preparing for a productive day, I've been in the staffing business, I would say, for well over a decade, in all different facets. And, sometimes you hear, you're not getting the same level of care. It's a headache to work with temps. I've been a temp myself. I've been a practice manager with temps. And so I've heard it all. And is it the most ideal solution? Of course not. It's a stranger coming into your practice. But the best thing that you can do is help prepare them to stay in their 20%. Keep in mind, when you have a dental hygienist in the practice, what do you want them to do? You want them to stay on time. You want them to produce, because when they're producing, they're not only providing comprehensive care and their patient base for that day is healthier, but you're also getting a return on your investment for the premium wage that you're paying them. So those are the only probably 2 things that and then the third thing is you want the hygienist to make the patient experience as comfortable and as uplifting and as positive as possible, right? That's their 20%. Produce, provide that great patient experience, and please stay on time. That's your 20%. The noise is, stocking their rooms. If they have to stock their rooms, and again, some of the practices are only allowing 15 to 30 minutes to come in prior to the start of the day for patient start time. And in that 30 minutes, you want them to set up their room, to prepare their charts with a practice management software they might not have used before in a practice they know nothing about. And you want them to do all of that and go to your 15-minute huddle. That means not a whole lot to them, but means a whole lot to your team. And so if you think about it this way, it's an advantageous of your team to prepare their charts. What services are the codes already in there for them so they don't have to think about how to add that in? Unscheduled treatment, maybe preparing their charts for them. A lot of our clients use laminated sheets to prepare for the day. And so maybe office is going to do that for them? Is their room stocked so we're not running all over the office trying to find where an extra probe is, or is, my polish is out? What does that look like? Instruments sharpened. If the instruments are not sharpened, your temp is obviously going to run behind because they're going to have to get creative on how to provide the patient care that they're expected to provide. Do they have a float assistance? If I'm getting stuck on something, is there somebody that I can page to quickly help me? Whether that's something dropped on the floor, something's not working, my sensor's not working, how do I communicate to the team that I need assistance? Pre-appoint, we want all of our patients pre-appointing within the operatory. And so that's a great plan, but that's just another thing outside of my 20% as a temporary fill-in provider another thing that I have to do. So is the front office willing to pre-appoint patients on that level? And then of course, treatment plan creation. Every office creates treatment plans differently and at different times throughout the appointment. And the last thing you want to do is have your temporary provider get hung up on how to create a treatment plan to your liking, and what to include in there. And so all of these things, thinking about ahead of time. So again, when they come in, they can stay in their zone of genius or their 20%. Now, over the years, I've known practices and I've heard doctors say, it's not worth having a temp in. I'm just going to close down my schedule. Because, it could be for a variety of reasons, but the most common is, gosh, now the temps are at a premium rate. Whether, again, it's from a staffing agency or you're hiring somebody internally, which you can very well do. If I'm doing $85 an hour and I'm giving that to Shannon, for example, and the pro fees are only reimbursed at 88, what's the point? And so I'm just going to close down my schedule. But we have to understand what the opportunity cost is. Yes, that may be an apples to apples comparison to what a pro fee is reimbursed at, but hopefully your hygienist isn't just doing a pro fee every hour. Hopefully they're doing an expanded scope of practice and practicing at the top of their license. And hopefully your practice is doing that too. There's also this element of your 80% of the doctor's column is filled with restorative from the hygiene column. So the more hygiene columns you X out of your schedule due to lack of coverage, you're going to see it slow down in your restorative schedule. Then there's patients that go off their continuing care routine. They may have a higher level of disease. They may need to be coming in every 3 months versus every 6. And so you take somebody that needs that type of care and they're pushed out 6, 7, 8 months, sometimes 9, sometimes a year. And that is not good either. That is not investing in our patient care, all to save money from a temporary premium. And then lastly, the worst thing that is going to happen is patient attrition. I have had neighbors, friends, and family members all have reported to me throughout the years, specifically in the last 5, that they're leaving their dental office because their appointment continues to get rescheduled and that they're short-staffed and they don't have enough temporary, or not temporary, just providers in general. And now you're having patients saying, see you, and they're going to go to a different office and probably never come back. That's worst case scenario. And that is the risk you take when you do not secure temporary coverage when one of your providers is out. It's also the risk you take when you have capacity issues and you don't have enough providers in general, not just a short-term leave. You're going to have patients transitioning out of your practice. So it's something to be very aware of in terms of not getting coverage or not being adequately staffed. Assisted hygiene is another option when you are down a dental hygienist. If you were to ask me about assisted hygiene when I first got into practice, I would probably say that is a horrible model. I don't ever want to do that, and it's not in the best interest for the patient. I still feel a little bit like that to this day. However, there are very creative ways, and our team has a wonderful course on it to make sure that that patient experience is at the top of what they expect, while running with one dental hygienist and an assisted hygiene column. We do this. There's practices that absolutely need to do this, whether they're a rural practice and there's not a lot of providers around the area, or it's an inner city practice where they're in that same boat and they're trying everything that they can to do to secure not only temporary coverage but hire for their practice, and it's just not happening in the timeline that they want. So there's also an assisted hygiene model. Questions about that, I'm happy to answer those too via email. The next position that we're going to look at is DDS locum tenens coverage. Now, when you get a dentist to fill in, I want your eyes to point down to the bottom of this slide. How many dentists do you actually need? And in a general practice, we always say 1,500 active patients per full-time DDS. Now, if you're doing what we call bread and butter dentistry, nothing wrong with that, by the way. So you're doing crowns, bridges, fillings, maybe a few Invisalign cases here and there, you might need, as a single provider, 1,600 active patients to fill your schedule and have a healthy, productive, full schedule as a dentist. If you have a wider scope of practice, you're doing endo, extractions, you're doing clear aligners, maybe all on X cases, the wider your scope of practice gets, the less active patients you need to have a full and productive schedule. So for conversation purposes today, we're just going to go with that 1,500 middle of the road benchmark. Again, an active patient is a unique patient within the last 18 months. For our outstate rural practices, it's going to be 24. So looking at that, and also if you're a solo dentist, of course, you're going to need locum tenens coverage if you're out. If you're a group practice and you have one of your dentists out, could you get by? What does that active patient count look like? And would you rather fill in the other doctor's schedules? That would be something that you would need to look at and be creative with. Should you find the need to hire a locum tenens dentist, the first thing that they need to be they need to be credentialed appropriately if you are an in-network provider with any insurance company. There are some ways around this. One of the ways is not, and I repeat, is not, this is not a good thing to do, is to have the locum tenens doctor post services underneath the owner's provider name in the practice management software. That is what we consider fraud, and that is not kosher on any aspect with that. The way you can get around it, also, you cannot post underneath the practice. We hear that a lot. Well, they're not credentialed in time, so we're going to post their services underneath the practice, or we're going to post it underneath the other doctor. That is not what we would advise. Now, if the practice in itself is not credentialed with a lot of insurance companies, it might be that your locum tenens coverage doctor just wouldn't see patients with a certain insurance company. So you're going to be creative with their schedule and only put patients in that they can see out of network, and your patients are used to being seen out of network. You're also going to want to really, really consider putting them as a W-2 status on your payroll for your practice, not a 1099 contractor. I personally feel like I don't have a popular opinion on this, but I also have personally gone through an audit for this particular thing with one of my staffing agencies. And the dental industry is one of the biggest offenders of not utilizing the 1099 contractor correctly. And I see a lot of associate doctors getting 1099. And of course, you can ultimately take the advice of your attorney, your accountant, and what they will tell you is a lot of offices do it. It does not make it right in the event you go through an audit. Any questions about the audit, feel free to email me. And the reason being is that this doctor is not, bringing their own tools in. They're not dictating when the patients are seen. Your front office is setting their own schedule for them. And there's a lot of other things to consider that you can look online and see the differences between a W-2 and 1099 contractor. The other thing to prepare them for is when they're going to be doing restorative, right? But they're also going to be working very closely with your hygienist. And in our practices, we're really big into systems. because that really sets everybody up for the long term and decreases stress on the owner. And one of those systems is, what is the expectation when the doctor comes in for an exam? What are the hygienists supposed to update the doctor on? And making sure that the dentist is aware of that so that the two of them in front of the patient are looking like this beautiful play on stage, right? You don't want to be fumbling around, not being able to communicate with each other, and also have kind of the same philosophy of care. So really meeting with the hygienist and them explaining what they're going to deliver in terms of an exam update and how that exam looks. Also, what is this locum tenens ideal scope of practice? If I'm a hygienist and I'm talking to a patient and I'm going to tee up maybe an anterior case, or I'm going to propose therapeutic Botox for clenching and grinding, I need to know if the dentist is okay doing that. Implants, for example, if I'm going to tee up an implant case for them, are they going to be placing them, or are we going to be referring them out and then restoring them back at the practice? So all of these things we really need to work through with your dental hygiene team, because they're going to be spending a lot of time within the operatory for that. Opportunity costs of not securing coverage. Of course, we have, again, patient attrition. We do have some doctors that will go on vacation, have their hygienist see patients, but the patients don't get exams. And if the hygienist sees anything, they'll have them back when the doctor's in. I don't know if I'm a fan of that option. You're missing out on an exam opportunity, and the practice culture is really at risk. Those particular patients, they do want an exam. Some of them are only coming in twice a year, and so they feel like they're shorted a little bit. Of course, I hope that practices in that situation are giving the patients a heads up that the doctor won't be in, but it's really not worth it, in my opinion. There are some virtual options that you can do for exams that we have seen our clients get creative with, but then also you want to plan for any ER limited appointments that they might need you for that particular day too. So really, if you need coverage, secure it, especially if you're a solo doctor. If you're a group practice, maybe you can get by with the other individuals within your office to cover your patient care. Let's look at dental assistants. Dental assistants can have a very wide scope of practice. You can have an expanded functions dental assistant. You can have a licensed dental assistant that hasn't done a whole lot other than, and I don't mean this in any other way, but their doctor has only wanted them to hold a suction and maybe take some x-rays, but they really haven't made a temporary crown in a really long time, or they don't know how to do digital scanning, or their scope of practice isn't that large. So figuring out, what is your current scope of practice within your dental assisting team, and what do you need to replicate? What would be their role description, so to speak, should you have somebody in the short term, and is what their qualifications are, does that match what you need? There's also an element of, is it going to be the only dental assistant, the main dental assistant that's out? Then you're going to be looking for that skill set. If you're running one column 8 to 5 and you have one dental assistant, that's going to be a bigger deal to replace versus if you run what we call a matrixed or dovetail schedule. We have doctors that run 2 or 3 columns. They work with 2 or 3 assistants. And then everything's overlapped, and they're really delegating 80% of their noise, right, to their dental assistant. So what does that look like to you, and what kind of coverage do you actually need? And then also, instilling, if you're not doing a morning huddle, instilling that at least with the dental assisting team during this short-term coverage will be very beneficial. And you can also almost have this temporary dental assistant come in and be kind of a gopher, if you will, between this different operatories, so that your main assistant can really stay in her 20%, his or her 20%, and have that float assistant for you. And there's lots of different options for whether it's an unlicensed assistant that's a float that can be really good, or another licensed dental assistant. For front office admin, this is all over the board as well. There's lots of different things, 103 tasks to be exact, that need to be done for a successful dental practice to operate at the front. When we work with practices from a front office standpoint, we find that probably 25 to 35% of those tasks are just simply not being done because they don't have enough people up front for it. With that, the practice does suffer in ways that they aren't aware of until they start looking at the opportunity cost of not doing those particular tasks. So when you have a front office admin that could be utilizing this new parental leave in 2026, you have to ask yourself, is it the main person that works up at the front? How many individuals do you have? Can you cross-train anybody? That would be another idea. But if you do need somebody that needs to come in for the short-term coverage, organizing the 103 tasks that are needed to be done into what we call patient-facing tasks and non-patient facing tasks. So patient-facing tasks are really that body that's in the chair, that's really welcoming the patients in, providing that great customer service experience. They're checking them in, making sure that all of their information is correct. And then when the patient's walking out, they're providing treatment plan presentations, financial arrangements, and of course, scheduling within the office. These are all things that a physical person needs to be in the office for. There are lots of tasks that a physical person does not need to be in the office for. So maybe you're going to outsource this to somebody that wants to work from home. You're going to pull somebody back out of retirement to maybe work from home in this aspect. There's lots of ways to tap into your server. If you have a server-based software, if it's cloud-based, it's even easier. There's lots of ways with your phone system to employ remote workers and even virtual assistants that don't live in this country. We do have some offices that utilize VAs as well. And these non-patient facing tasks would be delinquent AR, outstanding insurance claim follow-up, and quite frankly, even answering the phones. So there's a lot of creative ways that you could outsource this in terms of what patient and non-patient facing tasks are. The next thing to do is really prioritize, in a lack of better terms, what fires do you need to put out in your practice while this individual is gone? So things like scheduling, collections, submitting your claims on time, these are all crucial to life, should be done on a daily basis. Your social media marketing, content creation, sometimes even working your unscheduled treatment or your past due continuing care, those can all be on the back burner because chances are you might have overcapacity issues at the practice where the return on your time of working unscheduled treatment or continuing care is only going to add to the problem. And so what does that look like when you put it in those two buckets of what is a priority and what is not during this leave? And then also, like I had mentioned before, cross-training. Is your dental assistant interested in picking up some front office hours on Friday when the practice isn't open to catch up on some things? Maybe your dental hygienist is to have a different, change in practice, not being with patients, but doing more of the administrative roles. Can you hire a float? Is there a virtual assistant option? And also getting your team in that decision-making process could be very beneficial because they might be a little bit more creative than you in figuring out what they're able to kind of come together and contribute during this leave for you. With that being said, I know Lisa has provided you with a to-do list, and for staffing coverage preparation, I would encourage you to do this. Always assess the actual need, communicate with your team. Again, let their creativity flow and what could happen during this leave for you. And also just in general, should you have sporadic needs of short-term coverage, whether that's somebody that's out sick or somebody that wants to take PTO, it's really, really important. I can't stress this enough to have what we call playbooks. We help develop a front office playbook that really has what we call standard operating procedures, or we refer to them as SOPs. They're really the whole purpose of that is to have the front office systems run itself with the help of your team. That way, as a practice owner, you're not wondering if things are getting done. You're not wondering if your collections are snowballing. You're not wondering if you're wasting time on physical bodies trying to fill your schedule versus when you could outsource that and streamline those types of things. This is great to have a playbook for your current team to always refer back to, and it's documented that you guys have all agreed on that. And also for new hires when they're onboarding, what a great thing to have a training protocol. There's lots of different apps too that we can utilize to actually record the process as well, and to kind of create a video library in addition to just a paper manual or an electronic manual for that. Also, with your clinical team, having what we call a clinical playbook. If I am filling in at your practice and you want me to pre-schedule appointments, I need directions on how to do that. Like I'm talking screenshots because we don't know what practice management software you're using. And it would be very nice to have that. Or if you want us to create treatment plans, what should tray setups look like? What should I be delivering during an exam? What are the dentist expectations? Again, if I'm filling in as a hygienist, how often do I take x-rays? What's your x-ray protocol? What's your periodontal protocol? These are all very important to have, generally speaking, as a practice, not just for your temporary or short-term staffing coverage. With playbooks, I always refer back to Starbucks, and I mean, if you're a coffee drinker, you have frequented Starbucks probably several times, and I think they're up to almost 3 billion different ways that they can craft your coffee for you, and they really don't mess up a whole lot, and that's very wild odds when you look at it because they have systems in place to make their coffee. Next time you're in, you can view that. We want your dental office running the same way on your behalf, and and not only to that, but to your team's benefit as well. Having team leads is great as well. It takes the pressure off of a practice manager. It takes the pressure off of an owner if you don't have a practice manager, and really have an appointed person to assist with the success and complete quality control with that temporary person coming in. So again, I'm going to use myself. If I'm coming in as a dental hygienist, you should have somebody looking at my notes, making sure that my notes are complete, making sure that and checking in with me to make sure that my procedures are correct. And that what I'm doing is in line with what your philosophy of care is and your core values their core values of your practice as well. And lastly, gather patience. We get it, and I get it completely, that you are paying a premium to have this individual in your practice. And so therefore, sometimes the expectations are a little bit higher. We're paying this, expectations are high. But realizing, whether it's an assistant hygienist, dentist, what is their 20% and what do you want them to accomplish during their short time at your practice? Focusing the value on that versus everything start to finish will really help you narrow that down and get a more positive experience for everybody in the end. Thank you.